Urinary issues are one of the most misunderstood and mismanaged problems in feline health. Most people think of infection. Most vets prescribe antibiotics immediately. But here's the truth. The majority of urinary issues in cats are inflammatory, not infectious. And treating them incorrectly leads to recurrence, pain, and thousands of dollars spent with no long-term improvement. Today, I will give you the clear, evidence-based framework that proactive cat parents use to keep their cats safe. And towards the end, you will discover how you can avoid having to depend on so-called prescription diets to keep your cat from having blockages and urinary issues in general. I am Paola Zanibelli Davis, the holistic cat specialist. I have helped hundreds of cat parents fix recurring urinary issues through better understanding, smarter at home monitoring, and prevention strategies that actually work. Do your cat a favor, do your cat justice by feeding them the right food, and you will have fewer issues with the urinary tract. If you want practical help with UTIs, which is not necessarily urinary tract infections, but more often urinary tract inflammation, you are in the right place. Let's begin with the non-negotiable emergencies. If you see these signs, this is same-day vet care. Immediately, you have to go to the vet very fast. Straining in the litter box with no urine, crying while urinating, going to the litter box repeatedly with only a few drops, a male cat who suddenly produces no urine, vomiting paired with urinary symptoms, and also lethargy after straining. So a urinary blockage can kill a cat in 24 to 48 hours due to the bursting of the bladder. So we never wait and see with a blocked bladder behavior. So if you see any of these signs, go to the vet immediately. Now, having said that, urinary blockages can be very stressful for you and painful for your cat, on top of being really heavy on your wallet. When a cat gets blocked, the vet tends to have to put him under general anesthesia to insert a catheter inside the urethra, which is the little tube that takes urine from the bladder out into the world so and excretes the urine outside. So as I was saying, the vet tends to have to put your cat under anesthesia to insert a catheter inside the urethra, which is otherwise a painful procedure, and to unblock the passage to allow urine to come through again and the bladder to empty. This usually causes irritation, of course, and pain. I don't know if you've ever had a catheter at any point in your life. It's not a pleasant experience. And yes, it causes a lot of irritation and a lot of pain, a lot of spasms as well. So the urine is also acidic. And when your cat has to pee, he will feel that passing urine actually stings. Also, if crystals form in the meantime, they're like little shards coming through that tube. So again, ouch. So some cats resort to holding urine for this reason. And also remember that there are also possible spasms happening after a catheter has been inserted and then removed. And all this makes the situation worse and the urine more uncomfortable to pass. Stress can also lead to further blockages and spasms of the urinary tract, which is why the hours and days after a vet visit with suspected blockages are at high risk of recurrence. When a cat keeps blocking, vets usually suggest the PU surgery, or technically the perineal urethrostomy, which is a procedure that widens the urethra to allow urine and small crystals to pass easily, preventing life-threatening obstructions by creating a larger permanent opening. Now, this is not preventing crystals from forming again, and it doesn't solve the problem of inflammation. Inflammation can cause mucus, and when crystals are formed for several reasons, the mucus can agglomerate and, say, gather around them and make them bigger, which can lead to more blockages in spite of the bigger opening. So even when this does not happen, the surgery is quite invasive, and the recovery usually involves strict litter box management from your part and preventing leaking with an Elizabethan collar or a donut, which is one of those equipments. This is an inflatable, usually, or fluffy donut-shaped collar that gets around the cat's neck and prevents the cat to get to certain places where the surgery has been performed and leak himself, opening sutures and causing issues and potentially, at this point, infection by leaking, etc., etc. So a donut, this is what a donut is. If you haven't used one before and you don't know what I'm talking about, I'm not talking about the sweets, obviously. I'm talking about what is called a donut, as in an alternative to the Elizabethan collar, which is the collar that holds at the neck and then goes like a cone to prevent, again, cats from accessing the surgery area and lick it. And again, you can also use a recovery suit. But often the surgery involves also lifelong prescription of urinary diets. So all in all, it is definitely, the post-op is definitely quite intense and full on your part and also for your cat. Also, these diets that get prescribed after this are generally horrible diets nutritionally, with one compound inside that lowers the pH of the urine. And why would we want the pH to be lowered by this compound? Because most often the crystals in the bladder are struvite crystals, which form in high or basic pH, like 7 or 7.5 and above. So this is why the urinary diets, the prescription urinary diets, are generally prescribed. Now, I understand that a urinary diet can for a week or two for the cat parent who doesn't know how to go about giving supplementation to their cats, but you certainly don't have to overpay for low quality food that is not species appropriate for your cat indefinitely. If you have my course, the Pediatric Cat Academy, you will know everything there is to know about giving your cat supplements effectively, but without trauma. Being this your trauma from having your cat clawing through you, or their trauma from having you maybe run after them trying to give them a pill. If you don't have my course, the Pediatric Cat Academy, you can definitely sign up. There is a priority list at the moment. The course has not been aired officially, but it is coming very soon. So there is a priority list. If you want to put yourself on the priority list, you will be informed immediately as the course becomes available, with obviously extra perks. You can feed your cat the best food, possibly raw or lightly cooked, complete and balanced, high in protein, while adding a supplement in the correct amount that does exactly the job that you need it to do. Like, for example, in this case, making the pH of the urine lower. But it is a little bit more complicated than that. You see, when the crystals are not struvite crystals, but they are oxalate crystals or stones, this happens because the pH was too low in the first place to begin with. So before you give any urinary diet or you use this supplement that I talked about, which is L-methionine, first of all, you need to know the dose, because the dose always makes the poison. And so also with natural supplements, you want to know how much you need to give for, depending on which situation you're giving these supplements for. Before you use any urinary diet or you use this supplement to lower the urine pH, you need to confirm with the vet that indeed your cat is dealing with struvite crystals and not oxalate crystals or stones. This is because oxalate stones are not dissolvable through dietary modifications. They have to be mechanically removed with surgery. So this is why it is actually risky to blindly feed your cat urinary food, urinary prescription food, without knowing how low that pH is getting. You never want to get that pH consistently too low and create bigger issues. Here is where we get to the part of rolling up your sleeves like any super cat parent would do and start monitoring your cat's urine regularly to empower yourself with very valuable knowledge that can add years and quality to your cat's life going forward. And this can take a huge amount of stress off your plate as well, because a cat who can't pee is really a scary experience. If you have been through it, you know what I'm talking about. Some people even install litter box cameras to check if their cat goes to the toilet while they are at work. And this is definitely a useful thing to do, but you understand where I'm going with this. It is a very stressful experience. If you can avoid going through this, by all means, it would be better. So if you have my course, Advanced Cat Care Skills for Amazing Cat Parents, you can simply follow along at this point and you will know exactly what to do step by step, when to do it and how to do it. You will be an absolute ninja at getting your cat out of the woods when things get tricky. However, if you don't have my course, you can totally do this yourself. Get some urine test strips calibrated for cats. They are very inexpensive, and you can learn how to keep them viable long term just by carefully reading the instructions and making sure that you are handling them properly. And you can learn how to catch a urine sample at home and do, by all means, some research on how to interpret the different values on the urine strip, and you would be on your way, well on your way, to get a cat who does not run the risk of blocking. And all this while you are feeding a great diet that supports your cat's health in more ways than one. I do advise you to take my course because I know it can help you and it can do so much for you. But start from here if you don't have it and if you are dealing with this, and then we can talk about how to lower inflammation, how to lower stress, and how to keep hydration high so that your cat starts to have a real chance for big success in the urinary department. So if you can do one thing for your cat right now suffering from urinary tract issues, is not feeding kibble, as this can cause the very problem that you're trying to solve, because it is very dehydrating and it's so full of carbs, which raise the pH, that pH that we want to keep around 6.5-ish. So if you do want to follow along, I have the whole process laid out in the Advanced Cat Care Skills for Amazing Cat Parents, and the link is obviously in the description below. As always, if you're trying to hydrate your cat properly, by the way, check out this video next, which should be somewhere in the top of this video. And as always, I will see you next time. And until then, love your cats as much as you can.